5 years ago, I was diagnosed with breast cancer. My partner found it. 3 years later, a second and a third tumor were found in the same breast. And then I had the mastectomy and last year, and then after the mastectomy, a fourth tumor was found in the same non-breast. You lose your brain, you know? You totally lose your brain. You're totally
Really
freaked out. You're totally scared. I had just been to the health center and they didn't find it. And I went to a wonderful surgeon and he did a core needle biopsy and then 29 more. And there are just things that I wish I had known, and that's why I'm doing this. The biggest thing is I wish that I had known about core needle biopsy seeding of breast cancer. I think I'd still have my right breast. I think that the core needle biopsy spread my breast cancer. And I wish I had gone for an excisional biopsy. An excision means they take out the lump in its entirety. So they make a little slit, you know, they made a little slit and they took out the lump and then they biopsy it, they test that. And if I had had that instead of the core needle biopsy, I think I wouldn't have had it spread. If I had had just a single core needle biopsy, that could have been okay too. And now that I know this, I look back in the literature on PubMed, my favorite research site, and 20 years ago they're saying, oh, if you do a core needle biopsy, know where you went in, know where you came out, and then excise the core around the where the needle went in and out. And it makes so much sense, because then if you did dribble any cells along the way, you take out, you know, you remove all the material, all the there, and maybe I would have been okay if I'd had a single core needle biopsy, and if there had been a standard protocol for that, that would have been just, I think it would have saved me 2 years of trauma. There are some things that I think that I did right. I had the surgery the second half of my menstrual cycle when progesterone was dominant, and that's supposed to give you better survivability. It's amazing how common it is to have multiple tumors. I have moved towards ultrasound instead of mammograms. And ultrasound is so much better at finding lumps than mammograms. It makes me wonder why they even do mammograms, because mammograms are radiation and ultrasound doesn't have any impact. And you can actually, I was with a friend the other day, she went and she was worried she had a lump. She went for a mammogram, then she went for the ultrasound. With the mammogram they couldn't tell anything. With the ultrasound they could tell that it was nothing to worry about. So we all just went, oh. I was really insistent on wide margins. You know, the last thing I said before I went into surgery my first time was, give me wide margins. What nobody really knows is how often they're spread through the surgery process. And I would definitely get surgery. I would unquestioningly get surgery, but there's things we can do to reduce our likelihood of spreading cancer. There's still no standard protocol for a 1 centimeter margin around a tumor, and they say that if you have a 1 centimeter margin, you have the same chance of recurrence as with radiation. So you could skip radiation if you get wide enough margins. As soon as you have a lump on your breast, if it's not coming and going along with your period, learn about the biopsy process before you let them touch you. There are things we can do to improve our chances of survival, and it starts before you're even diagnosed. It starts as soon as you find the lump. Use something like PubMed for research. You know, do the medical abstracts. Go to breastcancerchoices.org and read the list of questions and be informed and help somebody. You know, what's so nice about that list of questions is when you're brain dead, which is what happens when you're diagnosed with cancer, it's really nice if somebody can help you. And having that list of questions I wish I'd asked is so important. And then I wish I had known about the federal program for breast cancer and cervical cancer, that if you're not insured, the federal program provides insurance to women who've been diagnosed with breast cancer and cervical cancer. And I wish I hadn't done general anesthesia. I did the first time, and I had to for the mastectomy too. And local anesthesia is much easier for me to recover from. One time one of the doctors told me to get a CAT scan, and then there was an article in the New York Times the next day saying, oh yeah, they have like 150 times more radiation than a chest x-ray. And I wish I had never had a single CAT scan. After the mastectomy, I could have gotten silicone implants. They would take my pectoral muscle off my rib cage and put in a silicone, bag. It's still a little hard for me to get kind of used to this new me, but some women get trams where they take belly or backs and they have to make a new blood supply to feed this new tissue. And then you have what appears like a breast. I'm really glad I had a good surgeon who saved my nerves. So I have no kind of phantom pain at all. I actually, still have a bunch of feeling, which I'm appreciative of. Yeah, so those are the things I did right. Surgery the second half of my menstrual cycle, good support team, wide margins, ultrasound, alternatives, good books, Students and Loves and Lisa Altschuler's book, Local Anesthesia, and physical therapy. After my mastectomy, I'd already had the second and the third lumpectomy. I was already hammered, and they didn't tell me how to do physical therapy. I had to go on the web, but it was already a week later, and it took me a while to get back good motion and movement. And I could have just done really simple things like put my arm in the air and make a fist. It's not active, it's not a lot, but it would have made a big difference. Your chances of survivability are better when you're in charge. It doesn't matter. That's what the studies show, that what matters is that you're taking charge of your own treatment.